Hello, everyone, and welcome to Care3 webinar, SDP. There's more than an app for that. So let's just jump in. I'm going to get started by showing you a few slides, and then we're going to go straight into the demo. What is Care3? Care3 is the super app for SDP. Why? Because it helps you do everything that you need to do when managing conditions for yourself or your loved ones. And how does Care3 work? It works because we're digitizing this chronic care lifestyle, managing medications, symptoms tracking, appointments, care tasks, secure messaging for communication, but also with really important privacy controls around data sharing and record storage. No other digital health offering has this breadth and depth of features. Care3 creates actionable data for you and your family and your care team across conditions to improve health outcomes. That's what we're here for. Now, what am I here for? And that's because we're an SDP family ourselves, the Williamses. And I'd like to introduce to you David the Fourth. David the Fourth has severe autism and epilepsy. He's 18, he's nonverbal, and he can be aggressive. He requires 2 aides to attend school. But he's also very smart, curious, and opinionated. Don't get him started about politics. We have 4 caregivers, including my wife, Dave's mom, who provide care 7 days a week. We use Care3 to coordinate activities, track symptoms and events, and document his health and care. And that's what's most important. We've been able to use the information that we collect and document in Care3 with his care providers, and David's symptoms have improved over the years. In fact, his frequency of seizures and his epilepsy have reduced over time to the point where he hasn't had, knock on wood, a seizure in over 15 months. That's what we're doing here with Care3. We want to help you and your loved ones live your best. So let's jump into the demo. This is Care3. And here you see a series of timelines on your home screen. And each timeline has its own purpose. What we do with SDP is we create an action plan for each loved one that we're caring for. Christine, in this demo, is our loved one. You can see her picture there. On the bottom navigation, the profile icon, which is third from the left, you can see that Catherine is the person who is using the app currently. And Catherine's Christine's mom. So we go back to the home screen via the bottom nav. We're going to tap into Christine's home action plan. Now, what Care3 does is we work with you to create an action plan that's based on the individual daily needs of your child or your adult, whoever you're caring for. And we create those tasks and have them delivered to the app as reminders to be done. So here you can see for Christine's home action plan, we have several tasks that need to be done. The one closest to the bottom is to tidy up the kitchen. I want to tell everybody that I will tidy up the kitchen. I just hit this red accept button. And what that does is it has my name and my picture showing that I am volunteering and will do this task. When I'm done, I can tap that done button, and that will communicate to everybody that it's complete. We give you some feedback, some congratulations, hooray, for getting that done. And here you can see that task has been completed. So what if you want to show the anxiety level that Christine is having? Well, here's how you do that. I just hit that plus button for anxiety, and you see a dialog box here, and it's 4-point scale, none, moderate, and severe. So I can choose which one it is. I'm going to say it's moderate, and then I tap done. And what that does is it now will update within the app, in the action plan, what that level of anxiety is. And what Care3 will also do, which I'll show you after we go through the hooray screen, is that Care3 also automatically charts the trends for anxiety. So I can hit that chart icon to the right, and it brings up my trended chart. And you can see from this trended chart that earlier this month, Christine's anxiety was mild, but it's starting to trend up to more moderate. And so what you want to do is understand that. Why is this happening? And you can start thinking about that and recognizing it and start taking action to reduce the anxiety. That's what this trended data can show you. So I just X back out of there. And then I can also look at other tasks. You can see I'm scrolling up. I can see other things that need to be done. What if I want to see what has to be done today as a whole? So I can come back out to my home screen, and at the bottom nav in the second icon is a calendar. So I can tap on this calendar, and what Care3 does is it goes through all of your timelines, and it pulls and orders all of the tasks that you have to do each day. So everybody can see on the team what has to be done here on the 18th. So the tasks that are available to be done will have a red accept button. The symptoms and or the clinical values that are available to be done will have this teal plus button. And then anything that's also complete, like you saw anxiety or tidy up the kitchen, will show either its severity value for anxiety, which we said was moderate, or it'll have a check mark showing that tidying up the kitchen is done. So what if in this moment, I want to let everybody know that I'm going to give Christine her midday meds? I can do from here in the calendar, I can also tap that accept button. And visually, now you see my picture to the right in that particular action for midday meds. So now if everybody comes into the calendar, they can see Catherine Macy is going to give Christine her midday meds. And so if I'm going to complete this task, I can just tap midday meds and I get this form, and you can see the done button at the bottom. That allows me to say done here. Now you saw the other way, which is we did it in the action plan feed, but then you can also do it here from the My Actions calendar. So you can see the button now says done at the bottom with a check mark. I can then tap the X to go back to the My Actions calendar. You'll see midday meds with that blue check. Okay? So now you see how Care3 can work using the calendar as well. Everybody gets to see what has to be done. Nothing falls through the cracks during the day. Everything's organized, it's clear, and when something's not done, you know it. So let's say that I want to accept the daily walk also. So here at the top, I'm going to tap accept. But the daily walk isn't done yet. Well, what happens visually in this situation? The pink dot that shows up under the 18 shows that there is an accepted item by somebody on the team, but it's not yet done. That means you can make sure that everything gets done on any given day. Nothing falls through the cracks. What happens if I have to add something on the fly? Some kind of event has occurred, and I want to make sure it gets into the action plan feed, because it's essentially a recording of everything that's happened over time. In the lower left-hand corner, you can see there's a red plus button. I tap that, and like any other app that you can add content to, it opens up a menu and gives you a list of content items that you can add. Like any other app, you can do photo and video, even audio here in Care3, and you can see those are the three that are closest to the bottom. But there are also health-related items, a measure, event, symptoms, and action message. I'm going to show you what each of those is. A measure is like a clinical value. So let's say you took blood pressure as a reading at home. I can just tap measure. By tapping into the select measure field, it'll bring me up a list. Here's the list. I can tap blood pressure. And then I can tap in the next one, and it's asking for the values. And let's say it was 115/75. And now I can see 115/75. And then my check mark in the upper right turns green because I have added the required fields. And then you go ahead and hit that teal check mark. And what the system does is it now is recording this blood pressure reading. So here you can see the blood pressure, you can see the value we entered, as well as the chart button. So when I tap the chart, you can see if there are other blood pressure readings that I've taken over time. And you look further down, you can see all of them itemized as well. So you get a chart as well as an individualized reading for any measure. I can also tap backwards and look at what the blood pressure readings were in April. So now you're getting a trend, and you can start seeing, well, where is it trending up? Where is it trending down? Where's the Systolic and diastolic, are they tracking with each other? Are they tracking separately? And then be able to share that information with your doctor so you can take really actionable steps to make sure that Christine's blood pressure is where it should be. So all of this information is in the palm of your hand. So an event or symptom is very similar to a measure. So we'll tap cramping. We'll say that cramping was severe. I can add a trigger, a cold, and you can then add notes, feeling better now. And then you go ahead and tap that check mark, and there you have cramping. That was added. Okay, and then it was severe. Now, the other item is an action message. Action messages are appointments or tasks. So let's say you have an appointment upcoming, and you say it's Dr. Williams. And let's say that's not May 18th. Let's say it's May 23rd, and it's at 2:00 p.m. You hit done. And it's going to say it's an hour by default, but you can say if it's longer if you want to change that. But I can enter notes, and I'll say for these notes, I can say make sure to record the instructions. I go ahead and hit the blue check mark. And now you can see that doctor appointment there with an accept button. Now, what's very cool is what Care3 will do if you go back out to your calendar. I want to look at the 23rd because I want to see that appointment. So I just tap on the 23rd, and right there you can see the Dr. Williams appointment there with the red accept button that we just added. So now everybody knows that there's an appointment on the 23rd as well. And that's another cool feature, is that I can look into the future and I can see the items that have to be done in future days that are planned. This all comes from our personalized action plan that we work with you on to create. That is true self-determination, and that's why we're here. We're going to tap into Christine's home action plan. If I just want to send a text message, I can just tap in that message box and say, hi, and that sends a message. Now, what can happen is when I send a message, somebody else who's on that care team can respond. And they can say, hi, how's Christine? And so now you can see that Rose Claire got back and asked how Christine is. I can respond back and say she's great. So you can have actual text conversations here within the action plan. And the entire team, remember, here's the team up here, everybody's involved in that chat as well. The last thing I'll show you is kind of a cool feature for your care team. Because Care3 does offer notifications, it's like messaging apps, and somebody sends a message or does an activity, it sends a notification. If I'm off shift, I might want to turn those off. Well, if you go into the settings icon in the lower right, I then can bring up notifications toggles. So I can say, you know what, when I'm off shift, I can turn these off, and so I won't get any notifications on my phone if anything comes through. If somebody completes an action, or if somebody sends a text message or whatever. Let's say I do want to receive text messages though, but I don't want any of the action reminders. I can just leave new messages on. And you do that, and then anytime somebody sends a text message, you would receive a notification for it. But if they just had an action that they completed, you wouldn't get a notification. There's even more here. I am going to pause to see if anybody has any questions. Okay, great. Now let me go back to my presentation. Everybody asks, well, how much does this cost for self-determination? Well, Care3 is offered as a technology services vendor for SDP families, and our subscription is $450 a year, and we're category 336, which is technology services. Really paid out of your spending budget. It's one annual subscription, so you would then renew for each year. We not only help you customize your action plan by working with you to capture information, to iterate on that. We also provide for you service if you want to make changes and do all of these things. We also provide for you reports that characterize even more of your data as well. We do that each quarter. And we help you with doctor visit preparation so that you know that when you walk into the doctor, you're ready with the latest. You have the right questions and you have the right data. This is what we do for that $450 a year. And that's why we say for SDP, there's more than an app for that. Who have we worked with? Right now, we have clients that are in Westside Regional Center, Orange County Regional Center, and San Diego Regional Center. We are adding new clients all the time. We have contracts with 4 different financial management service companies, FMSs. Eviana, Mainzel, GT Independence, and Cambrian. If you are a member of any of those FMSs or those regional centers, it's very easy to onboard us. But even if you're not, that's okay, because it only takes about 3 business days to get newly vendored with an FMS. And we're getting more and more regional centers approving our services. So that's very exciting as well. Care3 helps you do 3 things. Organize daily care activities so you and your care team know what to do and when. We help you track health experiences like symptoms, medications, and events to know what to focus on. Remember, we talked about that. And then 3, we help you share your results with doctors, therapists, family, and others who make treatment decisions. This is what we're here for. We're here for you. We are Care3. Thank you very much. If you have any questions, please send me a message to david@care3.co. And I look forward to hearing from you. Take care.